ನಮಸ್ಕಾರ. ನಾನು ನಿಮ್ಮ RJ VIKI ವಿಕಿ. ಪ್ರತಿದಿನ ರಾತ್ರಿ 9 ಗಂಟೆಯಿಂದ 12 ಗಂಟೆ ಕಿವಿ ಮಾತೊಂದು ಶೋ ನಡೆಸ್ಕೊಡ್ತೀನಿ. ಗೊತ್ತಿರೋ ಹಾಗೆ ಇವತ್ತು ಸದ್ಯಕ್ಕೆ ನನ್ನ ಜೊತೆ ಒಬ್ರು ಡಾಕ್ಟರ್ ಇದ್ದಾರೆ. ಬಹಳಷ್ಟು ಡಾಕ್ಟರ್ಗಳು ಬರ್ತಾ ಇರ್ತಾರೆ, ಹೊಸ ಹೊಸ ವಿಚಾರಗಳ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇರ್ತೀವಿ, ಅರಿವನ್ನು ಮೂಡಿಸ್ತಾ ಇರ್ತೀವಿ. ವಿ ಸೇ ನಾಲೆಜ್ ಇಸ್ ವೆಲ್ತ್, ನಾಲೆಜ್ ಕ್ಯಾನ್ ಕಾನ್ಕ್ವರ್ ದ ವರ್ಲ್ಡ್. ಸೊ ಅದೇ ತರ ನಾಲೆಜ್ ಅನ್ನ ಹೊರಸೂಸಕ್ಕೆ, ನಾಲೆಜ್ ನ ಡಿಸ್ಟ್ರಿಬ್ಯೂಟ್ ಮಾಡಕ್ಕೆ, ವಿಚಾರಗಳನ್ನ ತಿಳಿಸೋಕೆ, ಸಿಂಪಡಿಸೋಕೆ ನಾವು ಬರ್ತಾ ಇರ್ತೀವಿ. ಸದ್ಯಕ್ಕೆ ನನ್ನ ಜೊತೆ ಡಾಕ್ಟರ್ ಬಿವೇಕ್ ಕುಮಾರ್ ಇದ್ದಾರೆ. ಸೊ ಹಿ ಇಸ್ ದ ಯೂರಾಲಜಿ ಸ್ಪೆಷಲಿಸ್ಟ್ ಫ್ರಮ್ ಅಪೋಲೋ ಸ್ಪೆಕ್ಟ್ರಾ ಕೋರ್ಮಂಗ್ಲಾ. ಹಾಯ್ ಡಾಕ್ಟರ್, ವೆಲ್ಕಮ್ ಟು ಮೈ ಶೋ.
ಹಾಯ್, ನಮಸ್ಕಾರ, ಗುಡ್ ಈವ್ನಿಂಗ್, ನಮಸ್ತೆ.
ಹೇಗಿದ್ದೀರಾ? ಹೌ ಆರ್ ಯು ಡೂಯಿಂಗ್?
ಐ ಆಮ್ ಡೂಯಿಂಗ್ ವೆಲ್. ಹೌ ಆರ್ ಯು?
Good. I'm doing good. So basically, things are not going properly as we have decided, because it's a time of pandemic.
Yes.
Firstly, I will have to thank you for being the frontline warrior in this pandemic of this 21st century. So basically, I just want to know, so you deal with kidneys, you deal with prostates, you deal with things related with the kidney stones and all those things, correct?
Yes, sir.
So what is prostate, according, to just make it very simple to my listener or a viewer?
Yeah, so see, prostate is like any other organ of the body. So since we are so into speciality, the thing is that now we are in a day and age where we go more in detail. So it's just like a organ which is the size of a walnut or a chestnut, which is a male reproductive organ.
Okay.
So it's very quite small in size, but since it's in very close proximity with the urine bladder, where we store our urine, and rectum, from where we pass off stools and flatus.
Okay.
So it plays a very important role whenever there is disorders, which is quite common nowadays.
Okay.
And it's like a tube-like structure in between from where urine passage also occurs. And the main function of the prostate gland is for secretions and producing more of ejaculatory fluids.
Okay. So basically, this is how the prostate works on a human body, correct?
Yes.
Perfectly. So what is this benign prostatic hyperplasia? Basically, the common disease condition of this particular BPH.
Yes, that's correct. BPH is quite a common disorder, especially in the elderly above the age of 50. There is benign or a non-cancerous enlargement of the prostate, which is because of the deficiency of our male hormone, that is basically the testosterone, which occurs with aging. And this is one of the organs which gets enlarged secondary to that.
Okay.
So just also, since majority of the presentation does occur due to hypertrophy or hyperplasia, there are also other diseases which are missed, like prostatitis or conditions such as prostatic cancer, prostatic nodules. So all of these together as such is known as BPH, or benign prostatic hyperplasia. But as such, in that there will be many other subcategories as well, and that is where the real answer lies to urinary disorders as well as problems.
So basically, I just want to know what causes this BPH. What are the causes of BPH, to make it even more simpler to the viewer?
Definitely, no answer is always that simple. There is a lot of research work going on still in that. But as such, aging or advancing age with decrease in body levels of testosterone is the primary reason why the prostate glands enlarge. It's basically called a hyperplasia, not an enlargement. Means some part of the glands, they, because of the deficiency of certain hormones and the aging factors, become more in numbers and proliferate more.
All right.
The size of it gets abnormally large, which creates a lot of other issues such as evacuation disorders, urinary as well as fecal.
Okay. So basically, what are the kind of some symptoms in regards to this, which is associated with the BPH?
So basically, when it comes to the symptoms, there are broadly two major categories to it. The first major is patients presenting with irritative symptoms. Now, irritative symptoms means there is a more of an irritation factor whenever urination occurs, such as there is a lot of frequency. They feel like going again and again, which really does hamper a lot with the regular activities. We do get people, who are extremely distressed because they cannot go a certain distance in a car or a vehicle without passing urine, which is actually quite distressing, and which can be due to these disorders. Urgency or irritability while passing urine, these are all irritative types.
Okay.
And
Okay.
another form of the spectrum is basically the obstructive types, where the flow pattern is disturbed or the flow is less, or there's a lot of strain or effort required to pass the same volume
Uh-huh.
without
Uh-huh.
good results. So both of them are little different in spectrum caused by the same disease, and
Okay.
the treatment is very different for both. So that's where the fine line lies.
That's well said, doctor. And can this symptoms be troublesome to the human, or the person who's actually experiencing the pain? Yeah.
Yes, of course. See, as far as the troublesome symptoms are concerned, the initial symptoms are always localized. So, as
Okay.
I said, symptoms such as irritability or frequency or poor flow patterns can be the initial symptoms.
Okay.
Sometimes they can be more subtle than just vague pain in the lower abdomen or
Oh.
even infertility. I mean, I'm seeing young kids having not prostatomegaly, but as such, abnormality in the prostate causing infertility or partial or a complete blockage in the
Uh-huh.
semen flow. That also is very, very, very commonly seen nowadays. So disease spectrum is quite varied. But
Okay.
if left unchecked, it can also lead to kidney disorder and a failure of the kidneys, which becomes like a very major complication or a major long-term consequence of such a disorder. So a timely intervention can also save your kidneys.
I believe nobody wants to hear that bad news anytime, because timely negligence will ideally cause that particular failure of kidneys, swelling of legs, or probably if the kidney doesn't functions well, your body you're done with your
Yes, no,
body.
that's extremely true, and very unfortunately, it's something very close to my heart also, and something which I feel quite very sad about. That some things which could have been avoided, are just left unchecked, and patients come at the level in which nothing can be done, and
Yeah,
it is very distressing, not just to see the patient, also to the family to be suffering with a chronic disorder which nobody wants,
true,
and
true.
which could have been checked very much earlier.
So basically, we Indians, we have a common human tendency of taking this homemade medicines, or probably drinking some kashayas, having some tender coconuts, for the lower abdominal pain. They say they just drink. Okay, I think my body's overheated. They say it's overheated. My body needs some adequate liquid or something. I think if the pain persists or the pain
Yes,
continues.
that's correct. That's correct. There is absolutely no harm in home measures. In fact, there's a lot of wisdom, especially in the Indian home measures, and that is even appreciated everywhere around the world. We fail to accept, we fail to see it ourselves.
Yeah.
Uh, but if such a thing continues, despite of those things, then I think it should be
I
addressed.
think we should contact Mr. Bivek Kumar.
Contact to the doctor nearby. Get yourself checked, I think, before anything.
Doctor, do we have treatments which is available for BPH? Do we have?
Yes, in today's day and age, we have a lot of treatment for BPH. In fact, nowadays the medications are so advanced and so well.
Uh-huh.
Majority of the prostatomegaly patients do not require a surgery.
All right.
However, these medications also help in decreasing the size of the gland over a period of time. So
Uh-huh.
that helps in the long-term management as well.
Okay.
There is a very specific set of criteria as per the AUA guidelines as well as the EUA guidelines, which we also follow all here.
Uh-huh.
Like if there are early signs of kidney failure or recurrent UTIs or bladder stones or any structural abnormalities occurring. So if
Uh-huh.
those kind of things occur, then the definite treatment is a surgical, which becomes like a curative way, because then the chances of it recurring is
Okay.
very, very less because it's taken out physically. And
So
since nowadays there are so many minimally invasive procedures present, it is present as a no incision surgery or a laser surgery, which does not even require you. It's like a daycare. So, requires a 24 hours admission. So it's convenient for the patients also. And also even the recovery is much faster.
yes, so basically you get yourself admitted, or your admissions done today. You're discharged by end of the day or probably tomorrow. Is that
Yes,
correct?
that's correct. That's correct.
So anybody who's really suffering from prostate, or somebody from abdominal pain, or probably which is having that irritability while passing the urine, something such scenarios are recurring every now and then there are chances that they'll have to get in touch with a specialist.
Yes,
So,
definitely. That's true. And the main thing is that many of the things may be multifactorial. It's not that only elderly who face this problem, but
uh-huh.
also many young folks coming with undefined irritable symptoms. And on deeper examination, you find something related which you would not expect at such an age.
Yes, yes,
So,
yes.
and a proper intervention completely cures them also. So, a proper, instead of having long-term consequences.
So basically, there is nothing to worry if you have a prostate disorder. Is that correct? Because
No, it's absolutely true. When it comes to the prostate disorder, luckily we have a lot of newer generation medications as well as treatment modalities. And
uh-huh.
whenever a person who does present with prostatomegaly, there is certain substrata of people who then do suffer from prostate cancers. Now,
Okay.
for them, the treatment would be completely in a different way. So
Ah,
definitely identification of that particular substrata of people, and luckily by the grace of God, our genotype as such, we as Indians have less incidence of prostate cancers. If you say per se, if you say as a prevalence, and
okay.
as far as the disease is concerned, we have extremely good medications which are non-chemotherapy based, like
Okay.
hormonal based, which is
Okay.
well tolerated to the body as well as helps in curative.
That's cool. That's cool. Amazing, doctor. It was great talking to you. And I had a lot of information in regards to prostate, in regards to benign prostatic hyperplasia, and you have given a very good bird's eye view in regards to your particular content that we have spoken. And it was great talking to you, doctor. I wish you could have a pleasant evening. Have a great
Thank you.
day, and thank you for being the frontline warriors for us.
Thank you.
Thank you.